Chapter 12 is written well. It has just a really good, I think, foundational approach to working in the physical therapy setting with children. I like how it's broken down. I want you to start by looking at the objectives as we go through this narration and instruction, that you look back at these objectives. I think it could also be useful to pull out your study guide, which is in the lesson builder, and just look at the key objectives that I'm asking you to know about when it comes to working with children. And there's really just a few, but I'm going to capture the richness of these objectives and also what I want you to focus on in your study. So I think it's important to start with, the chapter does really well, to know that the needs of children are unique. Children have unique sensory needs, going back to infancy and really prenatal, in the gestationally as well, and that close bond with a parent. And as a result of that, children just become they're very dependent, as infants especially, on relationship with a parent, normally a mother. And in terms of, that makes a lot of sense in terms of just getting food supply, as well as warmth and just familiarity and a sense of security. And then slowly the infant will start to explore their environment. That's typically kind of using in a more gross way, the upper extremities, and then slowly exploring their more proximal environment through rolling, to eventually getting on all fours, and getting from sit to stand, and then starting to walk. And then over time, getting more of their exploratory needs met, but also their personal needs met by retrieving toys, getting toys, and interacting with the environment quickly, and then starting to get their social needs met through vocabulary and through play. And the importance of play cannot be underestimated. It's so important for children developmentally to be in a supportive environment where they are able to play with peers and to have that imaginative play, and over time develop those skills related to stop-start activities, jumping, and running, and then refining those fine motor skills that are needed for writing. Cannot underestimate the importance of nutrition. The author doesn't talk about that enough, but I want to just throw that in to for the child's health, that they're properly nourished with healthy foods to help with neurodevelopment, as well as with basic musculoskeletal development. So I like the model that's put out with the ICF model, how important all these personal factors are, and if there's an overriding health condition, how it's our job as therapists to help children to the best of their ability to meet motor milestones that are more typical. So I want you to know what autism is, just a basic definition, that there's a full spectrum to autism. I do want you to know the basic definition of clubfoot. Those that work with pediatrics will see clubfoot. Juvenile rheumatoid arthritis, inflammatory condition affecting young people. And just, again, a basic definition. I would go from like here to there. Oops. It didn't work out so well. Let's try that again. Sorry. Go back up. Just a basic definition of JRA. Let's see. Here we go. So this section, right? Okay. Scoliosis, I'm not minimizing the importance of other health conditions, but I just want to capture ones now that you may not see a lot of, but maybe you've heard of and just need to know a little bit more about the causes if you see these health conditions. Developmental hip dysplasia as well, so we're looking at what it is and what are some of the causes. And then after, developmental hip dysplasia, we're going to move on to osteogenesis imperfecta. It's up to the basic definition. And then again to neurodevelopmental health conditions, Duchenne's muscular dystrophy. And that basic definition is what I want you to know. Neural tube defect, that would be spina bifida. So understanding that basically what it is, first sentence, and then spina bifida, but you do not need to know all the subsets of spina bifida. Just know definition of a neural tube defect. And then Down syndrome, and specifically the definition and then some of the associated characteristics. Cerebral palsy, similarly, you'll learn a bit more. Actually, you'll have quite a bit more information on CP next year in lab as well as lecture. And kind of the basic definition of CP. Do you want you know the basic definition of fetal alcohol syndrome? And pre-cocaine, thankfully we're not seeing as many children born with this, but we want you to know about it because you may be working with adults who may have had cocaine exposure when they were in during their fetal development, embryonic and fetal development. Cystic fibrosis, similarly, a basic good working definition of CF. Pretty rare. Thankfully, there is some better treatments, but it is a much shorter lifespan associated with cystic fibrosis. So we're going to kind of skip ahead here, and you really need to know establishing outcomes as far as, of course, the PT is going to be diagnosing, but you really want to capture how important it is to have these positive outcomes related to therapy, and then what a negative outcome can look like as well, and how your role is so important in helping support the PT and the patient and their family in creating positive outcomes for care, whether that be a school system or working in a private practice. I suspect a lot of you know what IEPs are already, but a good working definition is important. I don't want you to know all the principles of examination. Scan over dynamic systems theory. I think that's important. The whole concept of that. There's so many complementary systems that are at work to help foster development and growth, and to maximize the more positive outcome when working with children. I learned about a little bit of NDT already from an earlier chapter reading in neuro. We talked a little bit about sensory integration, how important that is for children in particular. And there we go.